Aging, when guided with the right medical understanding, can be one of the healthiest and most empowered chapters of our lives. Yet many seniors entering their 70s face a confusing reality. Doctors continue to recommend a list of mandatory medical tests that have become so routine that very few question whether they are actually necessary, helpful, or even safe. But after nearly 3 decades of practicing internal medicine and geriatric care, I have seen a different truth emerge, one that is rarely discussed openly. Several of the most commonly recommended screening tests for people over 70 may no longer provide meaningful benefit and, in many cases, may increase the risk of complications, hospitalizations, and reduced quality of life. This article explores 3 such tests: the routine colonoscopy, the PSA prostate cancer test, and the cardiac stress test in asymptomatic seniors. If you're approaching 70, already past it, or caring for aging parents, this information can help protect you or someone you love from procedures that may do more harm than good. Why screening recommendations change with age. Medical screening tests are designed for populations where early detection significantly improves outcomes. However, 3 things change as we age. Life expectancy and disease progression timelines shift. Many cancers or chronic diseases progress so slowly in older adults that they are unlikely to threaten life during the remaining lifespan. Procedure risks increase dramatically. Sedation, bowel preparation, biopsies, invasive. Follow-up tests all become riskier after 70. The balance of benefit versus harm flips. A test that saves lives at age 55 may offer 0 benefit and significant danger at age 75. Yet, many doctors continue recommending these tests automatically, following decades-old habits rather than current evidence-based guidelines. Let's break down the 3 tests seniors should reconsider. 1. Routine colonoscopy after age 75. For decades, colonoscopies have been promoted as essential after age 50. But for healthy seniors over 70, especially after 75, the medical evidence paints a very different picture. What the guidelines actually say. The U.S. Preventive Services Task Force (USPSTF) officially recommends against routine colonoscopy screening after age 75, assuming previous colonoscopies were normal. Yet many seniors are still told these procedures are mandatory. Why the benefit declines after 70? Colon cancer is slow-growing. A polyp typically takes 10-15 years to develop into cancer. If your colonoscopy was normal at 60 or 65, your chance of aggressive disease forming after 75 is extremely low. Most seniors will die from unrelated conditions, heart disease, stroke, infections long before colon cancer becomes a threat. The risks no one talks about. The danger increases sharply after age 70. Bowel perforation. 1 in 300 seniors versus 1 in 1,000 younger adults. This often requires emergency surgery. Sedation risks. Higher rates of heart rhythm disturbances and breathing complications. Bowel prep dangers. Severe dehydration, electrolyte imbalances, heart issues, falls. Hospitalization rates climb significantly. A major JAMA internal medicine study following 50,000 seniors found no reduction in colon cancer deaths among those who continued colonoscopy after 75, but a substantial increase in hospitalizations due to the procedure itself. The exception when colonoscopy is appropriate: blood in stool, unexplained anemia, sudden changes in bowel habits, unintentional weight loss. In these cases, the test is diagnostic, not routine screening. 2. PSA testing for prostate cancer after 70. Prostate cancer is one of the most misunderstood conditions in older men. The vast majority of prostate cancers grow extraordinarily, slowly, so slowly that they never pose a threat. A startling medical fact. Autopsy studies reveal that 60–70% of men over age 70 have microscopic prostate cancer. Yet it never caused symptoms and never would have. So why are PSA tests still ordered so aggressively? Why PSA screening causes more harm than good? Studies such as the European randomized study of screening for prostate cancer, 162,000 men, 13-year follow-up show no reduction in prostate cancer deaths for men screened after age 70. Huge increases in biopsies, radiation treatment, prostate surgery. Each of these comes with serious complications. Urinary incontinence, sexual dysfunction, chronic pain, infection 2, 3% risk of life-threatening infection from biopsy alone. The downward spiral many seniors experience. It often follows this pattern. PSA test slightly elevated. Doctor recommends biopsy. Biopsy finds slow-growing cancer very common. Patient is pressured into surgery or radiation. The treatment, not the cancer, dramatically reduces quality of life. Many men spend their final years managing the side effects of a cancer that never needed treatment in the first place. What major medical organizations now recommend? American Cancer Society. No routine PSA screening after 70. USPSTF recommends against PSA screening after 70. American Urological Association. Same and less symptoms or high-risk family history. 3. Routine cardiac stress testing in seniors without symptoms. This may be the most dangerous of the 3. What is a cardiac stress test? It's a test that pushes your heart to maximum effort either on a treadmill or using medication to detect blocked arteries. For patients with no symptoms, especially seniors, the test is often more harmful than helpful. Why the medical benefit is low? A landmark JAMA cardiology study of 10,000 seniors found seniors who had routine stress tests lived no longer than those who skipped them, but they experienced more complications from unnecessary follow-up procedures. The hidden danger, false positives. Up to 40–50% of abnormal stress tests in seniors are false alarms. That means the test says there's a problem. A catheterization or angiogram is ordered. Doctors find minor blockages that never needed treatment. Seniors get stents or even bypass surgery that come with bleeding risks, complications from anesthesia, lifelong blood thinners. A common scenario. A healthy, active 73-year-old feels fine. Doctor orders a routine stress test. Result looks abnormal. They undergo angiography. A 40% blockage is found normal for a senior and not dangerous. A stent is inserted anyway. They spend the rest of their life on blood thinners. A minor fall now becomes a major bleeding emergency. All of this because of a screening test they never needed. When a stress test is appropriate, chest pain, shortness of breath, new unexplained fatigue, signs of cardiac ischemia. If you have no symptoms, the test offers minimal benefit. A real case Margaret and her husband. Margaret, age 76, came to the clinic feeling energetic and healthy. Her previous doctor had scheduled a routine colonoscopy, PSA testing for her husband, cardiac stress tests for them both. She asked a simple question. Are these tests truly necessary? Based on modern evidence, the answer for healthy seniors with normal prior screenings was no. Margaret and her husband chose to decline all 3 tests. Instead, they focused on daily walking, twice-weekly strength training, a balanced Mediterranean-style diet, blood pressure and cholesterol management, social engagement and cognitive activity. 5 years later, both are still active, sharp, and living independently. Meanwhile, 3 of their friends who agreed to mandatory testing suffered. A colonoscopy perforation requiring surgery, permanent incontinence after prostate cancer treatment, lifelong complications from unnecessary stent placement. This pattern is something geriatric physicians see frequently. The evidence supporting these choices. 3 major bodies of medical data align. 1 JAMA analysis show no mortality benefit but meaningful increases in harm from aggressive screening after 75. 2. The Choosing Wisely campaign. Over 70 medical societies agree these tests represent low-value, high-risk care for healthy seniors. 3. International comparisons. Countries with less aggressive screening of elderly patients have outcomes equal to or better than the U.S. 4 questions every senior should ask before any test. Whether your doctor recommends a colonoscopy, PSA test, mammogram, CT scan, or stress test, ask 1. At my age, what is the chance this test will actually help me? Most doctors struggle to answer this honestly. 2. What are the risks of the test and the risks of the follow-up procedures? Demand numbers, not vague explanations. 3. If you find something, would treatment actually improve my quality or length of life? For many late-life cancers, the answer is no. 4. What do major medical organizations recommend for people my age? Many doctors rely on outdated habits rather than current guidelines. So what should seniors focus on after 70? The interventions that genuinely extend healthy lifespan are simple, powerful, and require no extreme medical procedures. Strength training twice a week, crucial for muscle balance, fall prevention. Daily walking. Mediterranean or plant-focused diet. Blood pressure and cholesterol management. Social connection. Adequate sleep and stress reduction. Avoidance of unnecessary procedures. In geriatric medicine, less is often more. The bottom line. After age 70, health is protected not by doing more tests, but by doing the right tests only when needed, understanding the risks and refusing procedures that medical evidence shows may cause more harm than good. You deserve a medical approach rooted in honesty, transparency, evidence, respect for your quality of life. If you or a loved one is over 70, understanding the risks of unnecessary screening may truly be life-saving information.